Hi, welcome to Breathwork Coaching. My name is Coach Erin. I'm an exercise physiologist, mindfulness facilitator, breathing coach, and I'm here to help clients overcome stress and anxiety, specifically disordered breathing. So, breathing patterns that are dysregulated, such as air hunger, overbreathing, apnea, all of these types of dysregulated breathing patterns can lead to a lot of dysfunction and disorder in our body, keeping us stuck in that anxiety loop. So today's lesson is all about air hunger, understanding air hunger, overbreathing, breathing pattern disorders, and how they are contributing to stress and anxiety. Where do they come from? What keeps them around? What are we really talking about when we are talking about air hunger? Then the sensation that you can't get that satisfying breath. So I'm going to read through a recent article that I posted, or actually I'm about to post on my blog. And so I want to teach you a little bit about air hunger in the most comprehensive way that I know, and that's through writing. So I created this blog post, and I'm going to read through it for you today and let you just listen and understand it a little bit more. I will continuously be adding to this blog post as I learn, as I grow with clients. I get to experience clients who feel this differently than I do. So I personally overcame air hunger, panic attacks, disordered breathing, heightened levels of anxiety without going through medication, but with going through wellness and breath re-education, breath retraining, because I knew I was not breathing well. I knew my breath was off. So my background, my history in yoga and wellness and physiology, I just knew I wasn't breathing well. And so that was what I was really looking to change in my life. And now I help people from all over the world do this for themselves. So I love what I get to do. I love helping people who are suffering from anxiety and air hunger overcome this very frightening, very consuming, very frustrating, almost torturous breathing pattern. So let's learn more about it, okay? Quick medical disclaimer, I'm not a doctor. I'm not even a therapist. I am a wellness coach, a health and wellness coach. I teach yoga, I teach mindfulness, I teach movement and breath work and these types of things to help you turn down the level on your anxiety. I actually love working with doctors. I love working with therapists and creating an allied community, a support community for people who are trying to overcome anxiety, stress and anxiety in their life. So, medical disclaimer, this is not to diagnose, it's not to treat, it's just informative. It's information that I pulled together from my years of experience as a wellness coach, but also as overcoming air hunger and panic attacks myself and helping clients do that now. So, this is just informative. Please don't use this as medical advice. So there's my disclaimer. Let's get right into the lesson. The title of this article is Understanding Air Hunger, Panic Attacks, and Disordered Breathing, Impacts on Health and Mental Well-Being. What is air hunger? Air hunger, or dyspnea, is a distressing sensation of not being able to get enough air. This feeling can lead to anxiety, frustration, and confusion as the body seems to demand more oxygen than it can obtain. Although air hunger is a natural response to various physiological conditions, it can also arise from improper breathing patterns, a heightened sensitivity to CO2, and emotional stress. The Cleveland Clinic highlights that air hunger can signal serious respiratory issues, but may also be caused by anxiety, overbreathing, or incorrect breathing techniques. This dual effect on both mental and physical health underscores the importance of understanding and managing air hunger. Signs and symptoms of air hunger. Air hunger often overlaps with other conditions, making it essential to recognize a broad range of symptoms for accurate identification and management. In addition to the previously mentioned signs here may be some indicators: frequent yawning, an attempt to increase oxygen intake, especially during stress and fatigue. Sighing. These are deep breaths taken as a response to breathlessness or anxiety. Swallowing. Increased swallowing can occur subconsciously or in response to discomfort or shortness of breath. Increased respiratory rate. The need to breathe more frequently or deeply to compensate for perceived lack of air. Dizziness or lightheadedness, often associated with hyperventilation syndrome, which lowers our CO2 levels. Chest tightness, a sensation that pressure in the chest commonly felt during panic attacks or anxiety attacks. Shortness of breath, a feeling of not being able to take in a deep, satisfying breath. the sensation of a rapid or irregular heartbeat that can accompany breathlessness. Fatigue, feeling unusually tired or exhausted, often linked to insufficient breathing patterns. Dry mouth, an increase in the sensation of dry mouth, sometimes occurring alongside anxiety-induced breathlessness. Restlessness, an inability to sit still or feel the need to move frequently as a response of discomfort from air hunger. Difficulty sleeping, trouble falling or staying asleep to the discomfort of breathlessness. Muscle tension, increased tension in the neck, shoulders, and upper back, often associated with stress-related breathing issues. Blurred vision, temporary visual disturbances that can accompany dizziness or hyperventilation. How air hunger may develop. There are 4 areas that I want to talk about that are important to understand when you have the sensation of air hunger. It can come from 1, respiratory conditions. Air hunger can be caused by medical conditions that impair our lung function, such as COPD, asthma, pneumonia. This can make it difficult to exchange oxygen and carbon dioxide, resulting in that shortness of breath or breathlessness. Number 2, there can be cardiac issues. Cardiovascular conditions can impact our blood flow efficiency, limiting oxygen delivery to tissues that could lead to air hunger. Number 3, anxiety and panic disorders. Anxiety-induced hyperventilation is a well-documented cause of air hunger. Harvard Health reports that anxiety and panic disorders can lead to rapid, shallow breathing, often exacerbating breathlessness. Clinical psychologist Dr. Ronald Rampey explains that anxiety can amplify normal bodily sensations, creating a sense of needing more air than is physiologically necessary. Number 4, digestive issues and acidity. Digestive problems can contribute to air hunger. Conditions like GERD can cause chest tightness that mimics respiratory discomfort, increased abdominal pressure from bloating or diaphragm movement, impacting breathing. Additionally, an imbalance of the body's pH can lead to overbreathing. As a compensation pattern, the body attempts to correct this pH imbalance. And I'll note here later in this chat, I feel as a coach, it's super important for clients who want to work with me to first get a full medical examination, making sure that air hunger or shortness of breath, breathlessness, isn't caused by something else, isn't caused by a different issue. So it's really important that we know that it's connected more to anxiety and our nervous system being dysregulated. And that's going to be somebody who's going to be more likely to work with somebody like me. Moving forward, pseudo-dyspnea and its connection to air hunger. So a lesser known form of air hunger is the pseudo-dyspnea. I know I say it wrong. Forgive me. But basically, it's when we see air hunger in individuals and they're experiencing the sensation of shortness of breath or air hunger, but they don't have a physical cause. Like true shortness of breath, like true air hunger might be connected to some other type of digestive issue or cardiovascular or respiratory, like I just mentioned. This pseudo-dyspnea or air hunger is not linked to heart conditions or any of those other conditions, but it's commonly associated with anxiety, panic attacks, or hyperventilation syndrome. This is what I work with clients on. So this type of air hunger. In these cases, despite normal lung function and oxygen level, breathlessness still arises from this misinterpretation by the brain. So it's an overbreathing that's often driven by stress or anxiety that will exacerbate the sensation of air hunger, creating this feedback loop of discomfort, of disordered breathing and anxiety, and this loop just kind of keeps you stuck in this pattern. So by addressing this pseudo-dyspnea or air hunger, typically will involve managing anxiety through techniques like breathwork, mindfulness, wellness, also working with a therapist, especially if it's connected to grief or trauma. So CBT is known to break this type of cycle. Understanding how the brain perceives breath can be really crucial to relieving air hunger that's related to anxiety and panic and overbreathing patterns. So those are the types of people I work with when it's connected with anxiety. So let's go deeper. Let's understand the diaphragm, our vagus nerve, and the impact on breathing patterns. Breathing is so connected to our mental and emotional states. To grasp how breathing patterns affect anxiety and overall well being, it's essential to explore the diaphragm, the vagus nerve, and their connections. The diaphragm is a dome shaped muscle at the base of our thoracic cavity. It's separating the chest from the abdomen. It's kind of tucked up under the rib cage. It plays a crucial role in respiration. During the inhale, it's going to contract and move downward or flatten out on the inhale. This increases the thoracic cavity's volume and draws air into the lungs. That's why when you inhale, you should feel expansion in your belly. You should feel a stretch in your low back, your side body open up, the pelvic floor gets a little stretch. Then during exhalation, the diaphragm will relax. It's an eccentric movement of the muscle, so it draws upward, up higher into towards the chest, and this will allow you to expel or exhale air from the lungs. So inhale, we kind of stretch 360-degree opening, and exhale, everything relaxes in towards midline. So that's a correct breathing pattern using the respiratory diaphragm. What I see a lot of clients do is they're doing what we call a paradoxical breathing pattern, which I'll talk about, but basically it's like this. Maybe they're not doing it that elaborate, but they are doing an inhale using the secondary breathing muscles, our neck and shoulders, and they're drawing up on the inhale vertically instead of opening up horizontally. So we want to work on that with people who have air hunger, breathing pattern disorders, and anxiety. We also want to understand the vagus nerve and its relationship to the diaphragm. So the vagus nerve is a key component to the parasympathetic nervous system state. This is your rest, digest, restore, and recover. This runs alongside the diaphragm, so it plays a vital role in regulating internal organ functions, including our heart rate and digestion. The vagus nerve helps the body manage its stress response through its influence on the parasympathetic nervous system state. So when we slow down our breathing, when we use the correct breathing pattern, we're going to activate the vagus nerve. This will signal to the brain that the body's safe. All right, we don't need to be hypervigilant in fight, flight, or freeze state, our sympathetic nervous system state. We can access that parasympathetic nervous system state, rest, digest, restore, recover. And this activation is really crucial for calming both anxiety and those physical manifestations, those strange symptoms that anxiety can present for people. So we have to learn and practice how to be calm on a regular basis. The connection between breathing and anxiety. Dr. Stephen Porges, the creator of the polyvagal theory, emphasizes the importance of breathing and regulating our stress response. According to him, slowing down our breathing signals safety to the brain. This activates the vagus nerve and promotes relaxation. This connection between breathing and the vagus nerve is essential for overcoming anxiety and improving well-being. How cool is it? Let's just pause for a moment. How cool is it that this muscle within your body, I'm a physiologist, so I love this stuff. This diaphragm muscle within your body is like the pacemaker for all the different functions in your body, from cardiovascular to digestion to hormones to your immune system. And if you have been not using your breath correctly, if you've been breathing in suboptimal breathing patterns that I'll talk about in a moment, you're missing this major balancing kind of attribute in your physical body that can bring about homeostasis, that can bring about that balance that we need. And I know if you're feeling anxious and you have air hunger, like you are on. You are full fight or flight or freeze, and you are just consumed by this. So just think about the power of strengthening this muscle and learning how to activate it on a regular basis. And the good thing about your breath is it's always with you. And it can be hurting or helping you in any moment, but it's always with you. And if you learn how to use this respiratory diaphragm muscle, the pattern, if you learn the correct pattern of breathing, this can be super transformative. It can be so amazing. And it's just this tool you can always come to that is super effective and efficient at helping you connect more with that parasympathetic nervous system state. Okay, so correcting dysfunctional breathing patterns, engaging in practices that activate the parasympathetic nervous system, so not just breath work, but For sure, slow diaphragmatic breathing, all this can reduce anxiety and improve physiological responses to anxiety. This approach enhances mental health and supports physical health by restoring balance to the autonomic nervous system. That's the parasympathetic nervous system state and the sympathetic nervous system state. We want the sympathetic nervous system state, we don't want it to be on hyperdrive. And we really want to be flexible in our nervous system. That's when we are feeling true health, when we're metabolically flexible. Let's get into breathing pattern disorders and anxiety. Research shows that specific breathing patterns are linked to anxiety, and correcting these patterns can improve both physical and mental health outcomes. Dysfunctional breathing patterns such as hyperventilation, shallow breathing, air hunger, paradoxical breathing, these will all exacerbate dysfunction in the body and increase anxiety. So breathing pattern disorders and their symptoms. Here we go. We're going to go deep into this. The first one we'll talk about is overbreathing or hyperventilation, or what I see more now is a low-grade hyperventilation. This is characterized by rapid, shallow breaths leading to reduced CO2 levels in the blood. Symptoms include dizziness, lightheadedness, tingling in the fingers or toes, or feelings of breathlessness. I want to show you 2 slides real quick that show the impacts of overbreathing over time. So overbreathing means we're getting too much volume of air with each in and out breath. So the breathing air volume per minute is increasing. So it used to be lower, and we're seeing as society has kind of changed and our lifestyle has changed, we're seeing this increase. Moreover, this overbreathing is being connected to chronic health conditions. So here's some of the chronic health conditions where we see this volume, this liters per minute, this volume of air overbreathing, where we see these numbers are higher, and we see how they're connected to chronic health conditions. So this is a big deal. Overbreathing is, in my opinion, an epidemic, and a lot of us really have been overbreathing, stressed breathing for a very long time. And this has negative outcomes to our health and health in our body and health in our mind. The next breathing pattern disorder that I see a lot of, I mentioned it earlier, but it's paradoxical breathing. This is an abnormal pattern where the chest rises while the abdomen falls. So this disrupts our efficient gas exchange. Symptoms will include breathlessness, chest discomfort, and fatigue. So paradoxical means reverse. When you inhale and you're sucking in on the inhale, that is a reversed breathing pattern. That is the exact opposite pattern that we want on an inhale. So we have to work on inhale expanding, exhale everything falls in towards midline. Next breathing pattern disorder I see a lot of is mouth breathing. Go around, walk around in a grocery store, walk around in a park, just look around, and you're going to see a lot of people are mouth breathing. You might even be mouth breathing yourself. I know when I first got into this, I didn't think that mouth breathing was a big deal for me, but certainly when I talk, when I speak, I'm mouth breathing a lot. Also, just when I was deep into like watching something or focus really deeply on something, or if I was rushed, I tend to mouth breathe. So mouth breathing is actually a huge pattern of mine that I've been doing for a long time that's dysfunctional. Yes, it can be as simple as shutting your mouth and breathing through your nose on a regular basis, at rest, during low to moderate intensity exercise, and when you sleep. So throughout the day, the nose is for breathing, the mouth is for eating. Shut your mouth, breathe through the nose. It's also more easy for you to use the diaphragm when you breathe through the nose. So mouth breathing is when you're breathing air through the mouth rather than the nose, reducing your filtration of the air and reducing the diaphragm's effectiveness. Symptoms will include dry mouth, sore throat, increased susceptibility to respiratory infections because your nose is a filtration system. So we really do want to use it as it's intended to be. The next breathing pattern disorder is shallow breathing. These are superficial breaths that limit oxygen intake and increase breathing rate. Symptoms include frequent yawning, shortness of breath, and sensation of not getting enough air. If you have air hunger, you're likely shallow breathing. You're likely mouth breathing. You might be paradoxically breathing. You could be over breathing. So you're going to find that you might have some of these disordered breathing patterns. That's okay. Remember, it's a pattern. Breathing is a behavior, it's a habit, and we can change that habit over time gently through I'll show you at the end of this session kind of how I do it with clients, but there is a way to overcome this. So don't be freaking out if you're watching this video. You got this. I overcame it myself. I believe you can as well. Panic attacks. These are episodes characterized by rapid breathing, increased heart rate, sweating, feelings of impending doom. Oh gosh, I know that feeling. Feels like you're going to die. These attacks often cause or exacerbate the sensation of air hunger. Yes, I get that. Hyperventilation syndrome, a chronic pattern of overbreathing that results in low levels of CO2. Symptoms include persistent dizziness, palpitations, and heightened anxiety. Stomach gripping. Oh, yes, I know this one. This is tensing of the abdominal muscles. Usually, like those upper abs are really tight. They're kind of like crunching down on your stomach. Often unconsciously, we are doing this, which will restrict our diaphragmatic movement because we're gripping in that upper ab area. Symptoms include abdominal discomfort, restricted breathing, and tension in the upper body, tension sometimes in the jaw. So if you are a stomach gripper, and you're kind of have this anticipatory holding pattern, you're going to find that you're going to hold, and then usually it's like this apnea for a moment, and then we take a big deep sigh, and then we have an irregular breathing pattern, and then eventually we might go back to normal. And that's going on in the background when we're breathing. So stomach gripping is a big one where we're going to work to turn down the volume of your anxiety, help you overcome some of these gripping patterns that might be happening in the jaw, and the shoulders, and the belly, and the pelvic floor, and the butt, and the hands, and the feet. So you might have gripping patterns in other areas of your body if you have anxiety. Next breathing pattern disorder we're going to talk about, this is breath holding or shallow breathing during prolonged screen use. I said it, scrolling. If you are scrolling a lot, you might have this like apnea or disordered shallow breathing pattern that happens. And this is going to lead to increased stress and tension. So when we say like get out in nature, put your phone down, get away from the screen, there's reasons because it's affecting our physiology and our stress response. It's stimulating the nervous system. It also, you might have eye strain, increased anxiety, more of this breathlessness when you have screen apnea. So be aware when you're on and in front of a screen, whether it's your phone or it's even watching a movie, see if you're doing this breath holding pattern. And breath holding, we've kind of talked about this, but I'll say it again, it's an involuntary or conscious habit of holding the breath, leading to that breathlessness or increased anxiety when you do resume breathing. Now, there's a few more breathing pattern disorders that I work with, but I'm going to stop there. If you have more questions about these, certainly jump on a discovery call with me. I'll talk about that at the end. But I'll stop right there and we'll get into the role of CO2 in our breathing patterns.